In the news, we'll be covering stories related to an exciting new clinical trial in lymphoma, promising results in refractory acute lymphoblastic leukemia, and a novel investigational drug in thyroid cancer. In addition, we'll hear news from the ASCO 2014 Quality Care Symposium. All that and more starts right now on ONC Live News Network. I'm Laura Jones.
I'm Justin Gallagher. In lymphoma, two very promising agents, ibrutinib and nivolumab, will be teamed up in a phase 1-2 clinical trial of patients with non-Hodgkin lymphoma. Ibrutinib, a Bruton's tyrosine kinase inhibitor, is FDA approved for mantle cell lymphoma and chronic lymphocytic leukemia. Nivolumab works by blocking ligand activation of the programmed cell death 1 receptor on activated T cells and has received breakthrough status for melanoma and for Hodgkin lymphoma after failure of autologous stem cell transplant. Preclinical evidence suggests that ibrutinib and nivolumab could have synergistic effects for patients with hematologic malignancies. Details of the study are not available yet. It will include patients with diffuse large B-cell lymphoma, follicular lymphoma, and chronic lymphocytic leukemia.
Exciting news continues for chimeric antigen receptor therapy, or CAR-T therapy, as updated results of two pilot studies in acute lymphoblastic leukemia were reported. CAR-T is an immunotherapy that uses an approach called adopted cell transfer that involves engineering patients' own T lymphocytes to recognize and attack their tumors. The therapy, which was developed at the University of Pennsylvania and licensed to Novartis, holds tremendous promise for this group of patients who have a dismal prognosis. Preliminary data presented at ASH in 2013 demonstrated complete remission rates in 86% in pediatric patients and 100% in adults. The newest data, after 6 months of follow-up, showed a 90% overall complete remission rate in adults and children with relapsed or refractory ALL. In 27 of 30 enrolled patients who achieved CRs, 19 maintained their remissions. The event-free survival rate was 67% and overall survival was 78%. Notably, every patient in the study experienced cytokine release syndrome, which is an inflammatory response caused by elevated levels of cytokines associated with T-cell activation and proliferation.
The FDA has also granted a priority review to lenvatinib as a treatment for patients with progressive, radioactive, iodine-refractory differentiated thyroid cancer. The new drug application for lenvatinib was based on the promising findings from the phase 3 SELECT trial that were presented at the 2014 ASCO annual meeting. In this study, the risk of progression was reduced by 79% in patients treated with lenvatinib when compared with placebo, improving progression-free survival substantially, from 3.6 months to 18.3 months. In addition, the median progression-free survival in the second-line setting with lenvatinib following treatment with a prior anti-VEGF therapy was 15.1 months. These data hint at potential sequential activity for sorafenib and lenvatinib. Sorafenib was recently approved for patients with radioactive iodine-refractory thyroid cancer. The FDA is scheduled to make a decision on lenvatinib by April 14th of 2015.
Next, ASCO has just endorsed clinical practice guidelines on molecular testing in lung cancer patients that were jointly developed by the three medical societies: the College of American Pathologists, the International Association for the Study of Lung Cancer, and the Association for Molecular Pathology. The guidelines define which patients should be offered EGFR and ALK genetic testing and when and how such testing should be performed. The Joint Society recommendations are for testing at the time of diagnosis in all patients with advanced disease or recurrence, regardless of tumor size or patient characteristics such as gender, race, and smoking status. While no specific testing platform was recommended, it is advised not to use assays that utilize immunohistochemistry for EGFR and EGFR copy number analysis or ALK real-time PCR. The ASCO review panel noted that in addition to alterations in ALK and EGFR, rearrangements in ROS1 and RET have emerged as potential markers for testing. The guidelines advises against mutation testing for KRAS. However, EGFR and ALK mutations are not found in patients with KRAS mutations, so KRAS testing could be used to exclude EGFR and ALK mutations.
Also in the news from ASCO, the Society's 2014 Quality Care Symposium took place last week. One study unveiled a new tool to help oncology practitioners working across all settings to develop their own survivorship care plans, a recommendation from the Institute of Medicine. The creators hope that it will make the process less time-consuming and more straightforward for the nation's 14.5 million survivors and the healthcare providers who treat them. According to Deborah Mayer, chair of the ASCO Survivorship Care Plan Working Group, the overall adoption rate of the recommendation to develop survivorship care plans is less than 30%. Reasons cited for the low uptake by physicians include the time needed to complete these plans, insufficient reimbursement, and a lack of systems to make them part of routine practice for every patient. The hope is for the new tool to improve adoption of the IOM recommendation by reducing the time needed to develop survivorship care plans, as well as integrating the process with electronic health records. A pilot study of the new template conducted in 11 practices showed that survivorship care plans could be completed in a median of 30 minutes. According to a survey presented at the meeting, patients with lung and colorectal cancers whose physicians participated in weekly, treatment-focused tumor board had improved survival and were 60% more likely to enroll in a clinical trial. Overall, the vast majority of physician respondents indicated some level of tumor board participation, with just over half attending weekly.
Thanks so much for watching this week's edition of OncLive News Network. I'm Laura Jones.
And I'm Justin Gallagher.
We'll see you next time.